anal condyloma mimicking lateral spreading tumor, removed by loop clip traction endoscopic submucosal dissection. The patient was a 60-year-old female. During a physical checkup, colonoscopy revealed a 2 cm lateral spreading tumor, granular homogeneous type, near anal canal. First, we performed submucosal injection around the tumor. Then we did mucosal incision and created the flap. We used flash loop clip traction method. The flash loop was fixed on the lower border of the lateral spreading tumor by the clip. It was attached to the opposite side of the bowel wall by a second clip. This method provides continuous tension for traction of the flap. Then we can perform the en bloc resection easily. The total procedure time was 60 minutes. Pathology proved to be condyloma acuminator.